It's my real privilege to introduce Bert Baumgaertner to you all today. Bert's research is at the center of philosophy and the cognitive and social sciences. He's interested in a wide range of areas in both the humanities and the sciences, especially when they're connected to computation and evolution. And so we've asked Bert to describe some of his recent work, which is certainly very timely. And I'm happy to now turn it over to you, Bert, and thank you very much.
Thank you very much, Charles, for that introduction. I'm going to share my screen and just confirm that everybody can see that. If I can get a quick thumbs up. Awesome. Okay. Yeah, thank you very much for that invitation. So the talk is called Motivated Disagreement and Vaccination Decisions. What I'm going to do is divide the talk into 3 different parts. I'm going to talk first about what I want to call motivated disagreement, and that's based on research on motivated reasoning. I'm going to summarize that briefly. Then I'm going to talk about research that we've done on vaccination decisions, and then I'll finish with some discussion of ways in which we might resolve disagreements and how they might apply in the vaccination context. So let's start with motivated disagreement. I'm going to start with an exercise. I know it's lunch hour, but I'm going to ask you to do a little bit of math quickly in your head. A bat and a ball cost in total $1.10. The bat is $1 more than the ball. So how much does the bat cost? Now, if your gut reaction is anything like mine, I want to say something like, oh, the bat's $1 and the ball's 10 cents. And as long as there are no follow-up questions, I'm good with that. But then I realize, wait a minute, hold on. If the bat is $1 and the ball's 10 cents, and the bat is actually only 90 cents more, whereas I'm told that's supposed to be $1 more. Then I start doing some mental gymnastics and start increasing the cost of the bat and decrease the cost of the ball. And finally, I settle on an answer that is something like, oh, the bat is $1.05 and the ball is 5 cents. And so now the bat is in fact $1 more than the ball. So I have to do a little bit of extra work to make sure I get to the correct answer. This question, some of you might have seen this if you're familiar with this sort of literature. There has been a reliable set of sort of tests or questions that help us differentiate between 2 different styles of thinking or 2 different systems of thinking. We have what's sometimes called system 1 thinking. This is the idea that we have some way of being able to get answers in a fast and easy way. In many cases, those answers are good enough for most of what we do, but they do generally have a lower level of accuracy. Contrast that with system 2 thinking, which is slow, deliberate, or methodical, requires more effort. It requires more work in general, but it generally tends to have a higher level of accuracy, right? We're more likely to get to the correct answer. For a lot of decision making that we do, system 1 and system 2 give us similar answers, and so we don't get in any type of trouble. But in some cases, they really are separate, and we can get into some trouble. So let me illustrate that with another example. So suppose there's a new skin cream that has been developed. It's supposed to help with rashes, and we do an experiment, and we give some patients the new skin cream, and but we don't give that new skin cream to other patients. And we keep track of whose rash got better and whose rash got worse. Now, if you're looking at this table of numbers, for sort of first gut or heuristic that you might use is to be like, look for the largest number. So in that case, that would be 223. And so your first sort of heuristic system 1 answer might be, okay, the new skin cream helps rashes get better. But in fact, that's not the correct answer here. Getting the correct answer can be actually quite tricky. You want to do 2 things. You want to account for the fact that there's a control, right? That's the cases where patients do not use cream. But you also want to account for various types of causal interactions. In particular, you want to allow for the possibility that the new skin cream might actually make rashes get worse. So to get to the right answer, what you need to do is you need to look at the ratio of 223 to 75, right? For those who use the new skin cream, what's the ratio of them getting better versus getting worse? And compare that ratio to the ratio between the rash getting better and getting worse for those who did not use a skin cream. So if you look at the top case, the 223 to 75, that ratio is roughly 3. And in the bottom case, the ratio between 1 of 7 and 21 is roughly 5. So in fact, if you were a betting person, you should not use the skin cream if what you're trying to do is get your rash to get better. And so that answer is a lot more work cognitively to get to than the heuristic answer that we get at. So one of the things that we can actually do is use questions like the baseball bat question to assess what people's ability to work with numbers is. So we can place people on what's called a numeracy scale. And so what I'm showing you here is a recharacterization of some work that's by Dan Kahan. I have the link here, which I recognize is not applicable for you. I will have PDFs available at the end of this, and all the links available so that you can investigate these yourself. So what I'm showing you here is a sort of my cartoon version of what you will see in the work by Dan Kahan, which is as we increase or we look at people with higher numeracy scores, right, a larger proportion of those individuals are going to get the correct answer, right? So we see the ability to get a correct answer seems to depend on numeracy. Here's the trick, and here's what's really interesting and perhaps disturbing. Suppose instead that I give you the same table of numbers, but now instead of it being about new skin cream, we make it politically motivated or ideologically motivated. So in this case, we're imagining a city is trying to decide whether they're going to have a policy that bans carrying concealed handguns in public. And before they do that, we imagine that we have the following type of research where we looked at cities that did have those bans and cities that did not have those bans, and then we tracked whether they had an increase in crime or they had a decrease in crime. Now, individuals who lean conservative Republican are going to like this type of data because banning concealed handguns are thought to prevent people from being able to protect themselves from violent crimes. And so for a conservative Republican, this is some good data, right? In that banning actually increases crime. So the 223 is a nice, so that answer, even though we know it's incorrect, right, given the math that we just did in the previous question, fits in line with that ideology. You can, of course, manipulate this type of table so that you get something that would be favorable towards liberal Democrats, right? Here, the idea of banning concealed handguns would decrease crime. And so again, that heuristic answer sort of would line up with that ideology, even though that heuristic answer, the 223, is in fact not the correct answer, right? So Daniel Kahan has sort of done the study where he gives a large number of subjects one of these kinds of tables, and then checks to see whether people who have high numeracy would do just as well if they were given the gun question as opposed to this skin cream question. And what we find is that if the answer, the heuristic answer that you want to have, right, that first gut answer, if that is inconsistent with a subject's ideology, they're more likely to slow down and double check the work, right? They're like, is that really the correct answer? And so the orange line shows the participants, right? This is the cartoon version for the real data. I'm going to refer you to the paper. But for those participants where the heuristic answer was inconsistent with the ideology, they eventually got to the correct answer, and that increased as their numeracy scores increased. Whereas if the incorrect answer sort of was in line with what someone's ideology was, if the answer was something like, yeah, that sounds right, that looks right, they're less likely to engage their numeracy capacity to discover that in fact that first guess is wrong, right? And that the correct answer is at odds with their ideology. So this is known by Daniel Kahan and some of his colleagues as motivated numeracy. This is the selective application of the capacity for your numeracy, how good you are with working with numbers. And it might be conscious or it might be unconscious. Motivated numeracy is an instance of a broader phenomenon of what we call motivated reasoning. This is the selective application of system 1 versus system 2 thinking, right? So numeracy is a system 2 kind of thinking, and that sort of heuristic that you use about which one is the largest number, that's an example of a system 1 style thinking. And so motivated reasoning is a sort of systematic way in people are selective in applying one of those two ways of thinking. And again, this might be conscious or it might be unconscious. So what I want to call motivated disagreements are disagreements that rest on parties having gotten to their beliefs through some kind of motivated reasoning. So this may or may not include a very scientific debate, but I think in a lot of cases, this type of disagreement is going to be relatively common. And I'll say a little bit more towards the end about just how difficult it is to avoid motivated reasoning. Okay, so that's the sort of background literature on motivated reasoning and motivated disagreements, as I'm calling them. Let me turn now to a discussion of vaccination decisions and show you some of the work that I've done with various colleagues here in political science, philosophy, and biology and statistics through the Center for Modeling Complex Interactions, which is now the Institute for Modeling Complex Interactions. So in one study that we've done, what we did is we tried to hold fixed considerations about people's vaccine decisions related to like convenience or cost or their confidence in various sources of information. We tried to hold all those things fixed. And what we did was just ask individuals, what is your willingness to go get vaccinated, depending on the number of local cases? Now, I should say, we did this study in 2018. It is just sheer luck that we now have a pandemic. So when we were doing this, we were not doing this in the COVID context. We were doing this for a hypothetical disease. Nevertheless, what you can see is as we increase the number of local cases, we have the proportion of subjects that we had in our study where about half of them would be willing to get vaccinated when there were 0 local cases. Close to 90% would get vaccinated as we increase the number of cases to 100. And what I'm showing you here in this plot is just how the difference between the way we present information about morbidity, so this is saying how sick you might be and how long you might be away from work, varies or is different from when we told people information about what the likelihood of death was. So was the death 1 in 1,000, 1 in 100, or so forth. So not surprisingly, right, mortality scares people a little bit more, but these trends are still pretty close. They're pretty similar. Okay, so that gives you a flavor for what we did. If I were to plot this with something like age, you would see that the slopes would be a little bit different, right? Young people are typically less risk averse than older people, and so you'd have a flatter curve if I did this with older people. What I want to show you here is some reason for thinking that we have motivated reasoning going on. So we also asked individuals what their political leanings were, and we put them on a spectrum then between very liberal to very conservative. And what you see for any given number of local cases, so all of these colors here, I've moved them around 0 just to help you sort of see and individuate the dots, but we only ask for these 4 different levels of cases. What you see is a general sort of downward trend in that the more conservative one is, the less willing one will be to get vaccinated when there is 1 local case. Right? So there's a rough trend here. But here's what's really interesting. If I remove the other cases and we look just at the very liberals, the moderates, and the very conservative, what you can see is that the moderates tend to be as willing as very conservative. That's to say, they're not as willing as the very liberals. But as we ramp up the number of cases, so we're increasing the risk, and the number of moderates moves up and becomes more like the very liberals. So the suggestion here is that those who lean politically as moderates are more sensitive to changes in risk in the world. whereas the very liberals and the very conservatives are more likely to have already made up their mind and are going to be less sensitive or adapt less to the changes in the world. So this provides us for some reason for thinking that there's something about the worldviews in being very liberal or being very conservative that already makes you have made up your mind, whereas being moderate is going to have less of that type of impact. Why does that matter? Well, in some other research that we've done previous to this last study I was just talking about, is we looked at the interactions between ideology and trust. So what we find is as trust in family healthcare providers increases, so will a pro-vaccination attitude. And similarly, as trust in government medical experts increases, we also see that that has a positive effect in increasing the pro-vaccination attitude. But when we look at just ideology, as we increase or as individuals become more conservative, there is a negative effect on the pro-vaccination attitude. And we just saw that in the last plot as well. As individuals lean more conservative, they're less willing to go get vaccinated. And here there's also an indirect effect, which is as one becomes more conservative, trust in government medical experts also goes down. I think the most important piece of information in this plot is actually what's not shown, which is there's no arrow that goes from ideology to trust in family healthcare provider. So if you're looking to message or try to disseminate information that you're hoping is going to be interpreted in a more impartial way, the way to do that, according to this study that we did, is through the trust of a family healthcare provider, not necessarily through government medical experts, depending on the type of audience that you're expecting to be able to reach. So let me now say something about disagreements writ large, and then see if I can say something about the case of vaccination. So if I were to sort of put a picture or provide sort of a cartoon image of what we have in mind with motivated disagreement, we have something like two different types of beliefs, the orange and say the grape or the purple. And beliefs come from both a motivation and an information source, right? These two things sort of get combined in a messy way to generate a belief. On a lot of models for how to disseminate knowledge or how to correct people's beliefs or get people to develop some trust in scientific thinking, the thought is what we need to do is correct for mismatches in information. So this is sometimes called the information deficit model, sometimes known as the knowledge deficit model, or you might hear something like the scientific comprehension thesis, right? If we can help people in increasing their numeracy score, as we saw before, then that will fix the problem, right? Those are often the strategies that we see. Something about education and how to interpret information. And I'm not going to suggest that there's anything wrong with doing that, right? In fact, there's a lot of things that we can say of what not to do if that's kind of your strategy. So here's some things that you should not to do, ordered by decreasing levels of obviousness. Yell at them, grab a megaphone if that doesn't work, or use all caps in your text. Call everyone on the other side idiots or shame them in some other way. Be alarmist, tell them how we're all going to die and it's their fault. Be dismissive of their positions or reasons. And perhaps maybe a little less obvious of some things not to do is provide very detailed reasons for why you're right, or give generic advice for how the other side can further investigate. Why are those some things that won't quite work? Well, here's a quote that actually just came from last week from Heidi Larson, who's the director of the London-based Vaccine Confidence Project, taken from the Guardian. She says, anti-skeptical vaccine individuals and groups are actively seeking out people who are questioning and hesitant. And they are right there waiting to say, you're right. You have good reason to be concerned. There is a problem. We, by that she means the people in like the Vaccine Confidence Project or the social media in general, are just saying, don't worry, not really saying, tell me about your concern. Right, so this phrase, tell me about your concern, I think is really, really important. And that's not just going to be about information. So if we think back to this sort of cartoon picture of motivated disagreement, right, that in order to resolve that kind of disagreement, we're going to have to address two different sources of influences on belief, both people's motivations and the information that they have at hand. So here's some things that I think can help with if we have this in mind. And I'm saying this is in a not really, but kind of systematic order. Locate both the belief and the reason for the belief. When I say the reason for the belief, we mean not just the information, but also what are people's motivations, right? What are the sort of costs and benefits of them having certain beliefs? We know that this gets wrapped up in the social circles that we have. So that type of location means understanding and being empathetic of how beliefs tend to align with motivations, and understanding how a person's motivations is going to guide their belief formation process. That locating exercise also then helps provide some type of guidance on a path forward, because you can do things like provide messaging that is positive, which we know people are more responsive to, but what's going to count as positive messaging is going to depend on whether that aligns with people's motivations or not. And likewise, that type of messaging, after you've located someone's beliefs and their motivations, can also be made concrete instead of generic, right? If you try to yell some empty instructions to your friend who's lost in the woods without actually knowing where they are, you might actually make the situation worse, right? By knowing where your friend is, you can provide more concrete suggestions of what they might look for and what to do. So if there's anything you sort of might take away from this, as sort of a rule of thumb, those heuristics that you're going to learn, it's hopefully one of these two, or both of them. One, look, we try to maximize decision-making on as little information as possible. That's just efficient, right? If you ever say to yourself, yeah, that sounds right, you're using some heuristic to get to that answer. And the second point is, it takes more information and work to get me to believe something that I don't want to believe. To use myself as an example, there was a study that came out once about how chocolate helps with weight loss. I was totally on board and did not bother to look up at the science. Turns out that was a hoax. If I find out information though that like beer is unhealthy, I'm going to be doing some digging. I'm going to find where all the errors of that study are, because I like beer and I want to pay attention to the studies that say that beer is actually healthy for me. So here's some references to a variety of the things that I was referring to. As a great introduction to System 1 and System 2 thinking is Daniel Kahneman's Thinking Fast and Slow. The motivated numeracy work that was related to the motivated reasoning is by Dan Gahan. There's a link here. And then the next two, the risk and willingness to vaccinate and ideology and trust and willingness to vaccinate, is work that has come out of myself and people that I've collaborated with. The example of bad science and chocolate on media is a really great example. So I have that link there too. And finally, in trying to provide something concrete, there is a sort of debunking handbook that exists on the case for climate science, where there are some lessons there that might be transferable to the case of vaccination. And so I provide a link for that as well. Thank you very much for your time.
Thank you, Bert. That was really interesting. So pleased that you could take the time to present that to us today. I just wanted to remind everyone in the audience that we are happy to entertain your questions. Please click on that Q&A box in the bottom of your screen and enter your question there, and we'll pass it along to Bert. I didn't mention earlier that this, who I am, Charles Bach, I'm the Associate Vice President for the University up in Coeur d'Alene, and this was the brainchild of our group up here to bring some of the expertise of our colleagues from across the university to our communities, not just in North Idaho, but beyond there. We've got one question here now, which is a simple one that I can answer. And I mentioned at the beginning, the question is whether this presentation was being recorded, and it has been recorded, yes. I'm going to kick it off by asking a quick question of my own, if you will indulge me, I think. And that is, Bert, help me understand this. So how does that, you talked about that moderate adaptation to willingness to vaccinate. And does that reflect somehow the fact that the science is often changing? You know, what we say is science. I mean, this pandemic's a perfect example. The sort of value or lack of value for wearing a face mask has, from scientists, sort of shifted over the time. Do you think those things are connected?
Yeah, very much so. I don't know, I don't have any data on this, but if I were willing to make a bet, I think that what you would find is that the ideologies would track less willingness to wear a face mask. And I bet if you did something similar, right, that in low risk cases, then liberal Democrats are likely to still keep wearing a face mask in low risk conditions, whereas moderates will be lower, like the conservative Republicans. And that as risk goes up, they'll be more likely to sort of behave like liberal Democrats in that. So if I were a betting person, that's the hypothesis that I would make, but I don't yet have data for that.
Thank you. Okay.
Questions come in. Yeah, go ahead.
Question that has come in. Does the study encompass common reasons that people are unwilling to be vaccinated? And if so, which of those reasons are legitimate?
Yeah. So the study does not encompass the sort of common reasons. To do that, you have to do some studies that sort of ask people to provide sort of what their reasons or what that information was. So we did not ask those. So we can't assess whether those reasons are legitimate or not. I should also say whether a reason is legitimate or not is something else that depends on what your sort of background framework is, right? If you're talking about from, if someone says something like, they express something about their sort of worldviews, then from the perspective of a certain worldview, something might be legitimate when it's not from another worldview.
Great. I wonder, Bert, if you could just take a minute to talk a little bit about what that recent study that you cited a couple times. What did you do in that work?
The one on trust, or just the one on the risk and willingness to vaccinate?
Mm-hmm.
The latter one.
Yeah.
Yeah, we were trying to understand. We had a variety of hypotheses about what might happen with respect to the size of someone's city, whether they live in a rural or urban community, whether they commute, whether they had children, whether education mattered, income mattered. Like, there's a range of different reasons that people have to kind of keep track of that. But what was interesting was that we did not end up finding a lot of the sort of patterns that we expected to find. But the one with ideology is one that seemed to be pretty systematic. And so that was connected with the previous work that we've done on trust, right? And the ways in which people's ideologies can impact which sources of information they trust or don't. And that can then feed into their views, right, about whether they should be willing to vaccinate or not. And again, what we're trying to do is try to find, like, are there places where information has sort of not yet been politicized or is sort of invariant across various world views? Because sort of to sort of indirectly answer another question that I saw come up about, like, why would face masks become political at all? I think at the beginning of this, there was broadly a Western culture of not wearing face masks. Didn't matter what political side you were on, whenever you would get sick, right? In the Western culture prior to this pandemic, the idea was like, I'm still gonna go to work because I'm tough, hardworking American, right? And nobody really wore face masks very much. Whereas in a lot of Eastern countries, it's pretty common to wear face masks. So it's been interesting to watch the issue of face masks become a political issue when it wasn't one at all. Why is a really great question. I think that's in some sense more complicated than I would want it to be, but I just don't know exactly what the sort of sequences of steps would be that would make it a political one.
Could I just follow up on that real quick? Do you think has there been a change in the extent to which these issues become ideological over time? It just seems like everything now is ideological compared to, I don't know, 5 years ago or 20 years ago.
Yeah. I don't know. I suspect it feels like that, but that might be heuristic thinking too, right? I mean, so we can figure out, we can think of these salient cases, and so that often is suggestive to us that the probability is higher than it actually is. So we have to be a little bit careful about, how we think about this, because the heuristic reasoning, I think, would be in line with you, right? I feel that too. But whether in fact more things are political or not, I think we'd have to be looking at the policies and do a more in-depth investigation for that, which I have not done.
Mm-hmm. So do you want to take this question from Mr. Baird? Why would pharmas use mercury as a preservation in vaccines? That may be a little bit pharmacological for your...
I was going to say, I'm a philosopher and social scientist. I think we should be asking the experts in that case. I do know that things like, my heuristics are things like, if you told me chlorine was in salt, I'd be like, oh, that can't be good, because I know chlorine's supposed to be bad. And then I realized, oh, wait a minute, salt is made out of chlorine. And so I got to lean on the experts to sort of be able to answer something like that.
Yeah. And can you see these, right?
Yeah, I can see some of the questions pouring in. Yeah.
Okay.
Oh, let me, so I'm going to go from top down. There's a question about how the relationship between motivation and ideology and belief, what the relationship is, which comes first. I love this question because this is a beautiful philosophical question. None. I think we don't have a nice specific strict ordering where you have something like a motivation and then you get an ideology and then you get a belief. These things are really messy and complicated and feed back on one another. So what is likely to happen is you learn some things as a child or in your development that is both features of belief and something that influences ideology and your motivation. And then that sort of helps define what the next stage is actually going to be. So this process is really, really messy. And I don't think there's a simple answer to just say which comes first before the other. It would be nice if it did, because then we'd have a clear answer of what to go address. I should also say, I think I didn't necessarily emphasize this, because this is it's a messy relationship between these types of things. Be prepared to put in the work. Right? We often just want to take the easy way out by doing something like, well, you should just learn to better investigate things, and that's it. Or we might use 200 and something odd characters to try to push a view. Don't expect that to change things. Right? It's going to take a lot more work, given how messy the foundation is for what props up our beliefs. It's going to be a lot of work to try to address those.
Yeah, Bert, why don't we tackle this one from Laura? Could you provide a hypothetical conversation with someone opposed to vaccination that might help change their mind based on your findings? Let's turn you into the advocate.
I want to play, I'm a philosopher, right? I want to play devil's advocate here. I want to play both sides.
Okay.
Yeah, so I think I think one of the things we need to sort of look at is if we're confident in the knowledge production from scientists, which is tricky, right? Because in a lot of cases of science, there's a fair degree of uncertainty. And as we saw, right, the science was changing. I mean, the science itself didn't change. It's just the best that we could do, given the evidence that we have, is to produce this answer. As more evidence comes in, right, we might change the answers and we might increase our levels of confidence in those answers. So I think, one thing you might do is get people to recognize that that process of understanding or scientific investigation, which is just how learning in general works, right? So if I knew that someone already had that kind of understanding of it, then what I might try to do next is see what are their other motivations. So if you understand the social circles that some people keep, you might recognize that it's really important for them to maintain a shared belief with that sort of group. And by doing that, the kind of conversation I might then ask is, what do their sort of the leaders in that group think, or the sources of authority, right? So if it's a church group, I might ask, what does your pastor have to say about this? And then try to identify ways in which that person might be an authority, a trustworthy authority on this, or not, right? So if the pastor is not a doctor, for example, I might then encourage that person to say, you know, maybe you should talk to your family healthcare practitioner. And I recognize that there's a tension there, right? That you might end up having a belief that it's at odds with maybe something that someone in your group believes, but maybe, you know, the other risks that you might understand by talking to your family healthcare practitioner might be better off. On the other side, right, it might be that if someone says, oh, you know, say my pastor tells me I should definitely be wearing something, like I should be getting vaccinated, you might want to then further help that reasoning, right? You might say, is that also in line with what your family healthcare practitioner says? If you go to the link, the reason why I'm suggesting this is because if you go to the link on the debunking article, one of the best ways to help sort of disseminate scientific knowledge is to prevent the spread of myths in the first place. Once a conspiracy theory or a myth takes hold, it is much more difficult to reverse that than it is to prevent it from happening. And so I would use that type of hypothetical conversation to help further solidify the sort of scientific understanding and sources from which that comes from.
Great, thank you. Question here from Jeff that I'll go ahead and read to you. It's a little bit long, but I'm wondering about how much people actually seek a view that is most true given the reality, true in quotes. I've read that humans reasoning to justify themselves and to convince others of an evolutionary perspective on the development of reasoning. Is there an underlying assumption of people actually seeking the truth in terms of the reality of whatever is being investigated?
Yeah, this is an awesome and really hard question.
Yeah.
So let me give you at least sort of two contrasting cases. Skepticism towards the belief in evolution, for example, is something that has, if I get that wrong, if that belief is wrong, there's not much cost to me getting that belief wrong. But I do get a lot of benefit if my skepticism of evolution is in line with my social group, right? If espousing some type of skepticism gets me some sort of like social cachet or aligns with a certain group, then you would expect, and this is the evolutionary way of thinking about how ideas and beliefs spread, you would expect that belief to sort of continue. But if I had a belief that like fire does not really feel hot, it doesn't matter how many people in my circle are going to sort of have that same level of skepticism. It's only going to take a few instances for me to feel it myself to realize that, no, that's wrong. Fire is hot and dangerous. And I need to be more careful about that. So it matters whether the truth has some actual impact on people's lives. And the case of vaccinations is a really interesting one because once you've eradicated a disease or disease rates are super low, you've in fact actually gotten rid of the risk, which now makes salient concerns about vaccine safety. So it's not until you actually have a risk come back where you might make the salience of the vaccine safety now suddenly decrease and realize that, no, wait a minute, that trade-off is totally worth it. And I think that's the big challenge for maintaining high levels of vaccine, because it sort of undermines, or doesn't undermine, but it changes the incentive, right? If measles before several years ago was eradicated, and I hadn't gotten the MMR vaccine for whatever reason, you'd be like, well, yeah, I know it's not around. But as soon as you see outbreaks, you're like, no, I'm going to get the MMR. I'm not messing around with that, right? So that's what's actually tricky about some of these situations is the incentives sort of change as a result of the kinds of beliefs that people have.
It may be interesting for the COVID vaccine paradigm as the cases become more and more exponentially larger, that whether that will drive additional adherence to vaccines. So
yeah, I would bet it does.
I hope so. I hope you're right. Well, Bert, I want to thank you again. I think we're coming to the end of our time. I want to really thank Bert for his time and thoughts today. A lot of food for thought there, and I much appreciated. I also want to remind you all that we will send out the slides to all of you who registered, as well as to links for the recording of this presentation. We very much appreciate all of you in the audience for joining us today. I hope you've enjoyed the presentation. Thanks again, Bert, for your wisdom and for your words.
Oh, thank you very much.
Goodbye, everyone.